you're on.
Okay, so I'm here today to talk about just the care and handling of scopes and cords and rigid scopes and insulated instruments. So the biggest repair, I would say, in your scopes, in your cameras and your light cord cables are because of kinks. So oftentimes they are not coiled properly when they're returning back to the sterile processing or central service department, because everybody's in a hurry. They're putting, they get tossed a lot, but really the proper coiling is an over-under technique. Not that there's a ton of time in that turnover, but it can be pretty simple as an over-under, just to keep that loop pretty big. It's probably as large as a small saucer plate, but as you can see, there's no kinks in it, and it's round, it's nice and round. And it does give, when it is like this, if it's properly coiled in SPD2, also is easy for the setup, so that when passing off the table, it's an easy out, and there's no, taking out of the
it's not getting all kinked up and stuff like
right.
that.
Right, and how many times have you opened up a bipolar cord and it's in
spaghetti.
knots? So the same thing with your camera. The biggest problem here are your kinks in here. There are a ton of fibers in here, light fibers and information fibers, that have to go to your central body, which is being plugged in. And the same thing with this. So most people are aware of the camera head, so that usually isn't getting tossed around. It's the end of the cables that can hang off your table, that can get caught in the wheels, that get caught underneath things, and nothing should be laid on top of your cords too. So the same thing, a quick over under, and back in the container that it came in, just so that when it's traveling, it's isolated and immobilized. And that's the biggest damage usually to your camera. The rigid scopes are a little bit different. So if you can see right here, the rigid scope has got a lot of components. It's a lot more detailed than people think it is. In here, in between these spacers, so you have these little spacers, but the lenses are glass. So if you can look, there's 6 pieces of glass lenses in here. And this is a very thin outside coating. Oftentimes in surgery, sometimes the camera, the scope is sometimes used as a retractor, push things away. But any of that can cause a bend or damage to these. Just setting a light cord on top of it can damage it. A gown, any weight at all, can damage this. So the biggest thing with your rigid endoscopes to protect them is to make sure that they are isolated and immobilized, and making sure you have room on your back table. So hopefully today we can find out what maybe are some issues that staff is having, so that we can troubleshoot some of that. But making sure that it's isolated and immobilized in here, this will keep it tight. So transporting it back and forth to SPD should always be back in the container that it came in.
With nothing sitting on top of it.
With nothing sitting on top of it. So obviously it's protected inside here. But once you take it out of here and lay it on your back table, it should be free from anything. Like I said, any type of weight on it can cause it to get a bend in it. And when they're serviced, they also check for bends. They check for bends and kinks, and any type of black dot, which would, when they're looking through here, you can't really see it with your naked eye, but when you're looking through with another lens, you can see that any type of black dot is the breaking of your lens glasses in here. So they're just very fragile, and they need to stay isolated and immobilized. When you come down here to insulated instruments, so there's a new guideline from Auntie Amy that says that everything that's insulated has to be tested after each use. So it's a new protocol. So now sterile processing, anytime that any insulated instrument comes downstairs, has to be tested. And so they test it by running it through this insulation tester. Now this is an older one, so it's a little bit different. But what they do is they ground it, they turn it on, and they run it through. You can see at the end, that's gonna alert when there's an insulation break. Run this all the way down. And you can see here, you can even see the electricity coming out. So there's a break in that insulation. What that insulation break can do is it can cause a burn to a patient if that's, you know, inside the abdomen. And as you know, in laparoscopic surgery, you see about this much of the end of your instrument. So this here that you're not seeing that could be inside the abdomen can also create burns that no one knows about, right? That also can cause an infection, are in a high rate for an SSI. But also, if there's a hole in the insulation, which you can see, bioburden can get out. So if electricity can get out, bioburden can get in. And so what they're finding is, as they're fixing these insulations on these instruments, they're finding that there is bioburden that is growing underneath there. So that is one of the reasons that the ANSI guidelines changed. And they're saying that everything that's insulated has to be tested after each use, just to protect that patient that next patient. So the same thing with insulated bipolars. They also get tested. This here isn't a safe one to use for the bipolars. There's a newer one out that they're using downstairs, so I'm not going to shock myself and show you right now. But anyways, same thing there. Bioburden can get in, can live underneath there. So it's a lot more than maybe just them working. It's also the fact that you're protecting that patient at the next step. So because of that, making sure that your lab instruments come back the way they came upstairs, isolated and immobilized, and finding a way when you send your bipolars back down that they maybe are on top of the instruments, or coming up with a plan where they're back in a bullet bag or something to protect them as they go back down. I know that last week they had to send out 25 of these because, first of all, we have not been testing them ever. Nowhere in the industry have they been testing them. So now that they're testing them, they have to repair them. So after they pay for that repair, they don't want to keep sending them out, right? And that insulation can get broken just by sitting in a bin of instruments, up against scissors, up against osteotomes, rongeurs, anything that has that sharp edge can damage that insulation. And a lot of times you can't see that insulation break. So like you saw here, you can't see those tiny little holes, but you saw that electricity escape. And the electricity will escape just like the water in a hose. So it's gonna come out of the path of least resistance. So if you plug your hose, your outside hose in, it's got a tiny little hole in it. The minute you turn that water spout on, water's gonna come out that. The same thing will happen with electricity. So that's why that care and handling, making sure that after that point of use, that things are isolated and immobilized when they're traveling back downstairs will really guarantee that the next patients are safe, first of all, and that your equipment can be continually used without constantly going out for repair and then being down things that you need in the OR. And making sure that if you need something turned around, that it can be turned around appropriately because it's not damaged. So really that's all we're here for today. Do you have any questions?